So what are some areas, or what are some of your thoughts on this list of the 7 areas for patient experience improvements?
Well, you talk about scheduling and how hard it is, but that's a critical one. Let me take it from the point of view, the question I asked you, and what I think it takes to get this done. One of my philosophies is that you have to leverage your core products as much as you can. So your core EHR vendors have offerings that you need to be looking at to do some of these things. And it's very possible that as a CIO, what you're dealing with is people in ambulatory or people in strategy are finding niche products and saying, let's go try all these things to answer some of these solutions. You don't want to be in that position where you're in react mode to all those niche products. So you also have to be partnering with all those folks. Whoever's in charge of ambulatory, whoever is in charge of patient engagement or patient experience. Oftentimes the strategy people are driving some of this in terms of your digital health strategy. So you need to partner with them as the CIO, help drive it, and make sure that they understand everything that can be done with your core products that are already there before you start adding in these niche products that then have to be integrated. Those are the key points. I guess one other thing I would say is, with everything else on your plate, this may be like, oh yeah, we'll get to that when we get to it, but then you find yourself falling behind competition and in your market. So figure out a way to take some steps in some of these areas with focus team, so that you get moving on it.
Yeah, it's interesting. You brought up because some of our vendors have very extensive amount of offerings, and I find CIOs fall into 2 camps. There's and some people that both of us are in contact with and really respect have taken your approach and said, yes, our vendor, we're double paying for a lot of this stuff because we have all these different solutions, and let's consolidate around this our EHR provider's solution because it's already integrated. It works pretty well. That's one school of thought, and it's a very valid, very good school of thought, because it's highly efficient to go that route. And then there's the other route, and I find some players going in this route where they go, you know what, we need to differentiate. And if we just go to the market with MyChart, we're not going to be able to differentiate because everybody else in our market's using MyChart. And so they're looking to free themselves a little bit. And so they're putting, new layers in between so that they can